Indian, North Carolina. Caitlin Marie Deal will be singing the national anthem. A little bit about Caitlin. She is a junior at the University of North Carolina at Pembroke, majoring in elementary education. She is a proud member of the Lumbee tribe. She enjoys singing with her family. They have a gospel group and they serve the Native people all across the great state of North Carolina. Caitlin is very proud to be the current and reigning Miss Indian North Carolina, and she's excited to be here. You will see that. Caitlin, will you please share the anthem with us, please?
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we'd watch were so gallantly streaming, and the rockets rankling bombs bursting gave proof through the night that our flag was still there. Oh, say does that star-spangled banner wave o'er the land of the free and the heart of the brave. Thank you.
Thank you so much, Caitlin. What a beautiful, beautiful voice. I want to officially welcome you to the 46th Annual North Carolina Indian Unity Conference. We are so glad that you are here. It looks like there are about 50 participants joining us so far, and hopefully we'll get a few more jump on and enjoy the conference. My name is Gwendolyn Chavis, and I serve as the president of United Tribes of North Carolina. And I want to just pause for one quick second and thank, and I'm sure I'll thank her many times throughout, thank Dr. Leslie Locklear. She's serving, she says her role at the moment is our technical assistant for the United Tribes Unity Conference virtually, but she is so much more. And I just want to give a huge shout out to Dr. Leslie for all of your help in helping us to make this happen. This year, our theme is Strong Roots in Changing Times. And I certainly think that all of us can attest to that we have had a lot of changing times, especially over the past year. It's ironic that the conference is falling on the 1-year anniversary of the pandemic. Last year when we held the conference, we were I guess we were on the onset of the conference. We were worried that we were even going to be able to have our conference last year face to face in Raleigh, but we did, and we had a very successful conference. But many of us have, especially our children, have had to adapt to the world of virtual learning, and they've adapted well. And many of us have had to adapt to teleworking, and we're still adapting as we proceed through this pandemic. All of us are very familiar with the 3 W's, washing our hands, wearing our mask. It was interesting that I didn't see anybody with a mask on. And of course, waiting to be 6 feet apart. But we have remained strong in our roots and grounded in our faith, and we will persevere through this pandemic and anything else, of course, that's going to be coming our way. Even though we're missing some of the elements of the conference that you will see over the course of the next couple of days, we are just very glad that you are here with us, and we thank you for helping us to continue our quest to unite our Indian tribes and organizations for the common good of all American Indians. So with that, I would like to ask Mr. Greg Jacobs, who is the tribal administrator for the Kahari tribe, to give an invocation and bless our conference.
Okay, thank you, Gwen. Our people in the past have been very spiritual people. They depended on a power greater than their own for our survival. And we still do that today. We pray to him. So let us pray. Our Father, Creator, thank you for this day and all the many blessings you have rendered unto us. We look to you for all things that are good, realizing that you know tomorrow, and we do not. We have to look to you. Thank you for the perfect plan you have created for us because of your endless love for all creations. Help us to have eyes that can see and ears that can hear the pure truth as we learn, lean not to our own understanding, but every word that you speak as you order our steps. Guide us from confusion and fear as we know that it is not of you and has no place in your kingdom. We ask that you bless our Unity Conference this day. We pray for the leaders of this country that their hearts may be open to the people. We pray for the sick and afflicted, the troubled, distressed, and the prison bound. And we ask that you lift this pandemic from our land. Creator, help us to seek peace in one accord. All of the days of our life, we will forever give you the praise and the glory for all things. And it's in Jesus' most precious name that I pray. Amen.
Amen. Thank you so much, Mr. Greg. Your prayers are always so heartfelt. Thank you so much. At this time, we're going to have an opening song, and it's going to be presented by Mr. Tony Clark, who is our Legal Aid of North Carolina representative on the United Tribes Board. Thank you so much, Tony. At this time, we are going to have a video presentation by Governor Roy Cooper, who is the 75th governor of North Carolina, has been since 2017.
The thousands of American Indians who've been living. Hi, everybody. Governor Roy Cooper here. Today we celebrate the rich history and heritage of the thousands of American Indians who've been living on this land for more than 12,000 years. North Carolina is proud to be home to the country's largest indigenous population east of the Mississippi River. As governor, I'm committed to keeping the promises of our treaties and compacts and making sure our indigenous communities have the resources needed to get through this pandemic and emerge even stronger on the other side. Every year, the North Carolina Indian Unity Conference honors people from the North Carolina American Indian community who've made tremendous contributions to the community and our state. I've enjoyed coming in past years, and while the ceremony this year looks a little bit different, I'm grateful we could still get together virtually to celebrate this important work. Thank you for shining a light on North Carolina's American Indians and promoting unity, education, and prosperity for the tribes across North Carolina. Thanks so much.
Thank you, Governor, for those kind words. At this time, we will have some remarks from Preacher Ricky Burnett, and he serves as the chairman of the North Carolina Commission of Indian Affairs. Reverend Ricky Burnett is the pastor of Pleasant View Baptist Church in Fairmont, North Carolina. He serves as the moderator of the Burnt Swamp Baptist Association. He's the current speaker for the Lumbee Tribe of North Carolina. He also serves, as I've said, on the North Carolina Commission of Indian Affairs and is their current chairman of that board. Reverend Ricky Burnett graduated from Cape Fear High School a few years ago and joined the United States Navy and served faithfully for 24 years before retiring with the rank of Master Chief Petty Officer E9. Reverend Burnett holds a Bachelor of Science degree in psychology from Troy State University in Montgomery, Alabama, and I'm very glad to call him my friend. Preacher Burnett.
Thank you, Miss Gwen. Let me say it is an honor to be with us today during this 46th annual Unity Conference, that we can come together as our people, even though it may be virtual. We have those, but I want to thank you. I want to thank Dr. Leslie. I want to thank your committee, United Tribes, for giving me this opportunity to speak to us briefly today. And I like the theme that you have, deep roots, strong roots in challenging times. There's always a challenge in life, no matter who we are, no matter where we go. But in order for anything to survive, for anything to strive, for anything to prevail, it takes strong roots. And I admire this United Tribes because you could have just closed up and said, no, we can't do it. We've got COVID. We've got all these problems. But because of your strong roots, because of all the vast knowledge that you have, you were willing to prevail and go forward to give us this opportunity. Also, on behalf of the Commission of North Carolina Commission of Indian Affairs, we have come and stood strong together. And when I say that too about the strong roots, I would be amiss not to mention Greg Richardson, who is our executive director, who is one of the roots to it. But with our 8 tribes and our 4 organizations coming together as those roots, keeping things together. And it's been a struggle this year. It really has. Many people, we've have challenges, with losing money, our jobs being gone. But one of the things that I would have to say is that through the commission, They've worked closely with the North Carolina Department of Health and Human Services, ensuring that the services are being provided, that, you know, the COVID testing was being done, that we also had the contact tracing, that we got the vaccine, all those things that could be done, you know, but it's because people come together and work so closely together to make these things happen. And that's what we need. The other thing is that our programs through the commission are still working. We got our workforce, we got our housing, we got our domestic violence. All these other things have still prevailed on. But again, it's because of those strong roots. And when we've got strong roots as a nation together, as Indian people of North Carolina, these things can still prevail. It may come up short, we may be behind just a little bit, but because of that, we can still prevail and go forward. Even here at the commission, the staff has had to work remotely, but because again, boy, they've worked hard. They've continued to make these things happen. We've even had some of our staff, some of our commission members that have run into the problem with the COVID also, but still they were willing to go forward. And one of the things I'd say also is that we as an Indian people of North Carolina have come together, the tribes doing various and different types of things. And again, I'd say it's because of the deep roots that we have one for another and trying to make things happen, to better our people. Again, I mean, I'm like you, Miss Gwen. I would have loved to have seen some of the other things, the powwow, the dancing and all, but still this is an opportunity that we can come together, that we can go forward, that we can just be all that we can for our people. So I just want to encourage us, just encourage you, you know, have those strong roots, because when when that root is tapped down, when the wind comes, when the storms blow, you know, we may bounce back and forth. We may twist and we may turn, but ultimately when you look at it, when that strong root is there, that tree is still standing, may lose some leaves, may have difficulties, but I believe that is the United Tribes of North Carolina and our Indian tribes. That's why we're able to stand together. That's why we're able to prevail. That's why we're able to take and go forth, because of our strong roots with one another. So, I mean, I could go on, but Miss Gwen told me, being a preacher, don't get carried away, don't get long-winded or anything like that. But let me say, God bless each and every one of you. And it has been truly an honor to speak to you. And let me say, continue to be safe. Continue to wash your hands, wear your mask, and try to do that social distancing so we can continue to be strong for one another. God bless each and every one of you. Thank you.
Thank you so much, Preacher Ricky. You could have talked just a few more minutes.
Well, I was in the military and I follow orders.
Okay. I think we're just a little early before our next presentation, but I did want to just take a minute to sort of give you an overview of what else is going to be happening today. We will have our COVID presentation from folks at the Department of Health and Human Services. Our workshops are pre-recorded workshops, so you won't have to scurry around like you would normally do at the conference to go try to find your session where it's located. It will be just a link, and of course, clicking on the workshops, and you can actually attend all of the workshops. You will have that opportunity to do so. So our workshops will be available at 4 p.m. And then this evening, we have a delightful gospel singing lineup for you that will be available at 6 p.m. And I have had a preview to that, and you will certainly enjoy the gospel singing that has been lined up for you. At this time, I also want to just give a shout out and thank our speakers for today, all the people that were on the platform today. Thank you for helping us to make this happen. It looks like our COVID presenter, maybe both of them, are in place, and I'm going to ask Greg Richardson if he will do our presentation of our guests from the Department of Health and Human Services.
Thank you, Gwen. and good afternoon.
Mr. Greg, you're muted.
It's all right. We'll change. Okay, can you hear me now? Okay, can you hear me now, Gwen? Okay. I can't hear you, but
That's perfect, Mr. Greg.
great, great. Okay, my apologies for the technical glitches there, but it is a live production. Gives me a great pleasure, and it is an honor to be a part of the 46th North Carolina Indian Unity Conference. It's been many years of us pulling together a theme of unity and working on issues that relate to our Indian communities and tribes out there. And so we're so pleased today to be able to take a look at what's been going on with COVID-19 in our state. And we have two wonderful speakers today to help bring us up to date on that. And I just want to let you know that we do appreciate them taking time out of their busy schedules to be part of this event today and to be able to speak directly with our tribal leaders and our American Indian communities across North Carolina. We have two speakers, and first I'm going to introduce Ms. Norma Marty. And Norma is no stranger to our communities. Norma and I have known each other for many years, and we have worked together on various activities and committees and been part of various things in this state for quite some time. Norma is a bilingual Spanish Puerto Rican professional with over 20 years of addressing Latinx and Hispanic health equity in the state and in this country. Norma is focused on engaging this historically marginalized population with resources and healthcare. Norma has conducted hundreds of grassroots presentations, as well as attending national, state, and local conferences to be the voice of those whose voices are not often heard or included. Norma has staffed hundreds of exhibits, health fairs across the state's minority grassroots communities before retiring from the North Carolina Department of Health and Human Services. Norma uses evidence-based outreach strategies based on social marketing principles to inform limited English proficiency refugees and immigrant populations about the benefits in the state's health plan and work. So we're so pleased to have her with us today. And secondly, we have Dr. Adade Millock, and forgive me, doctor, if I got that name a little bit wrong there, but she leads the COVID-19 Response Command Center for the North Carolina Department of Health and Human Services. She oversees state deployed resources in the response and including several aspects of vaccine operations. Prior to her current role, she worked as the senior medical advisor at CMS and as a major management consultant to public sector and health organizations. Dr. Millock is the clinical assistant professor of medicine at the George Washington University School of Medicine and Health Sciences. She earned her AB from Harvard, her MD from Stanford, and completed her internal medicine residency training at Massachusetts General Hospital. Ladies and gentlemen, please join me in welcoming our wonderful speakers for today's session. Thank you. So we'll ask Norma if you will go first, and then we'll follow accordingly. So good to see your face.
Always
Thank
good
you.
to be here, Greg. Thank you so much. I'm going to cover for Dr. Malik because she's probably en route from Greensboro, but I can surely fill in until she shows up. It's an honor. Actually, I wanted to be at the conference regardless of speaking or not. I have been a part of your conferences for many years when I was in public health. Always felt welcomed and very much a part of the work that you and your tribal governments have been doing in North Carolina from way before I was on this land. I've been here 30 years and I like to claim it as home. And I welcome the history and the roots that you have maintained for the rest of us to enjoy and to learn from and to be a part of. And so I hope I honor your space today with the information that I'm going to share. There's a lot going on. Yet Greg said I was retired. I do have gray hair. I retired in 2019, and last year I was out doing a mission trip in Cuba. I got in just before they closed the airports. So luckily I'm here. If not, I'd be in Cuba today, building God heaven knows what I would be building there. But I'm grateful to be here, and I'm grateful to Deputy Secretary Money, who called me last June and said, Norma, can you come back and give us a helping hand? Because it's a pandemic, and we have not really been prepared for a pandemic in our state. We've been prepared for hurricanes, we've been prepared for other natural disasters, but again, as a world, we're really living and breathing something that's new for most of us. Most of us have not had the opportunity. I guess now we can say we've actually lived through. So I want to, first of all, take a moment to honor the 126 American Indians who passed on, who transitioned on due to COVID. So if we could just take a minute to honor their lives and their contribution to our state. Okay, so with that, I'm going to try to do this technology thing by sharing my screen. Let me know if you see my slides, because if you don't, that means I'm not doing something right. And of course, I don't see my slides. So let me close you guys out and see if I can find my slides. Okay, there. So can you all see them? Somebody say yes.
No, ma'am, Miss Norma, we can't. You have to, at the bottom of your Zoom screen, it says share. If you'll click that share button, it should.
I thought I did that, but let me try it again. All right, let's go back, share screen. And there it is, show all windows. I don't want that one. Where is it? Oh, I hate technology. I do. Let's see, there it is. Let's see if I can share this one. Is that the right one?
Yes,
Yeah.
yes,
You can
ma'am.
see it now, yay. Okay, so again, see if I could do the whole screen. There we go. There. All right, great. So again, I'm Norma Marti, and again, there's so much to tell you. I'm just going to try to touch the surface. If you have any questions, please put them in the chat. If I can't get to them today, I promise you that I will get the information back either to Leslie or to Greg so that you can get responses to any of the questions you may have. As you started off the conference, and many people have already mentioned, our biggest campaign back in June and July of last year was to get us all to wear our masks, to maintain the distancing, and to wash our hands. And that's still critical. That's going to be critical pretty much for the rest of the year, regardless of whether you've had a vaccine or not. I listened to a presentation a few weeks ago. A doctor was saying, think of this prevention as a stool with 4 legs. So we've been doing the masking, the distancing, and the washing hands, and we were kind of wobbling because we didn't have a vaccine. Well, now we have vaccines. Not all of us have them yet, but we will hopefully before the end of whenever. And so once we have all 4 of them, then our stool will be stable and we won't be falling off and hurting each other and ourselves in the process. So again, keep in mind that this is still protocol, and it's something that we all have to, not only for our own protection, but for our families and the people around us. Again, we've already, since December of past year, we've started vaccinating. We've had 2 vaccines for the most part. And just last week before, we added a 3rd nationally. I think you would be proud to know, if you don't already, that North Carolina is really up at the top of the 50 states in administering vaccines. And again, administering them in as equitable way as possible. I have to say that the work of the historically marginalized population work groups, of which Greg and other folks from your community are a part of, myself included, we've really been pushing, working with and alongside of the staff at the Department of Health and Human Services to ensure that all communities across the state, all communities, regardless of abilities and past injustices that we know all of our populations have endured, are on that path to receiving a vaccination. Important for everybody to know that it's free. We've already paid for it. It was our tax dollars that paid for the development of these vaccines last year. And again, it's free. We've paid for it through our tax dollars. I like to say it's not really free because we have already contributed the money that created the research, and the actual production of these vaccines comes from our tax dollars. And again, the sad part is that because we're at the point of everybody, the numbers are just exploding. We've had so many people infected across the country. We've had over 800,000 just here in North Carolina. That we just, the supplies, the production of these vaccines has been a little bit slower than anticipated. It is picking up, and we're seeing that it's picking up. And again, adding a 3rd one has really been amazing, incredibly amazing. And so everyone will have an opportunity to get a vaccine when there's more quantities, and again, when it's your turn. And I have to stress the term, your turn as a way for us to try to be equitable with the distribution. So again, I just want to reemphasize nothing that you don't already know as a community and as a people and as leaders in our state, that there has been historical facts that have caused our people to not want to believe that something that the government is going to give us is going to actually be good for us. But we have to believe that those long-standing inequities and trauma that many of our people's faced are not at the heart of what we're doing today in North Carolina. That today in North Carolina, we really are trying to look for solutions and to be there for all North Carolinians, not just some. The question of safety is always an issue for us as a community. This just happened a year ago, and here we are already. I think we've vaccinated over 2 million here in North Carolina alone. How can we trust it? How is it safe? And I think the important thing for us to know, again, I'm not a doctor. Dr. Malik will be in later and she'll talk to you. But again, our universities here in North Carolina, UNC, Wake Forest, a lot of the universities were part of the development, the clinical trials that were used to develop these vaccines, these 2 of them specifically. And so they didn't just happen overnight. These are vaccines that have been on the rotation. SARS is not new, as many of you remember back, the H1N1 and the what was called the swine flu. Those are cousins, if you would, of the coronavirus. So there are lots of things that have already been tested and tried out and figured out what would work, what wouldn't work, what might work. And so when we got the virus and was identified and structurally decomposed, there was already a lot of knowledge about what would and would not work. And so the development of these particular vaccines was not an overnight thing. It was really decades in the planning. Again, they followed protocols. Clinical trials were conducted across the country, across the world, actually. The important thing that you have to understand is you cannot get COVID from getting a vaccine. There's no COVID virus in the vaccine. And as I mentioned earlier, the supplies are limited. And again, we're using the slogan, you have a spot to take your shot. You just kind of have to wait on that spot. And some of us who are a little older have already gotten our spot. But again, it is coming and we're moving along. We're already in stage 4, and I'll be talking a little bit about those stages in a minute. Here you see Dr. Corbett. Dr. Corbett is a North Carolinian. She's one of those scientists that worked on the development of the Moderna vaccine. She's one of our own. So again, this isn't, mad scientists out there in, mad science world. These are real people who have made a lifelong commitment to working on vaccines and to working on issues like what we're confronting today as a pandemic. And if I understand correctly, she'll be in town with Dr. Fauci sometime in the next week or so to talk about the development of the Moderna vaccine. Again, we have 3 currently. We have Pfizer, BioNTech, Moderna, and Johnson & Johnson's, which is also sometimes referred to as Janssen. I think many of these companies have subsidiaries. So again, vigorously tested. They're very effective. There was between the Pfizer and the Moderna over 100,000 people. Well, between all 3 of them, over 100,000 people were involved in the clinical trials. Excuse me. And again, the clinical trials, the companies tried to make sure there was a diversity of people that were used, ages, races, people with or without certain kinds of chronic diseases. Not one in particular, but there was a nice diversity across the participants. And what they discovered is that they protect you, that these vaccines can help prevent serious complications from COVID. It might not protect you from becoming infected, although that's clearly what happened to the people that were in the clinical trial. But if you were to get infected, your severity of infection would be less, and your rate of death from infection would be very low. So that's the importance of getting everyone vaccinated. There were no serious side effects. There weren't any crazy, genetic mutations from any of these 100,000 people. It's been almost a year, well, almost 6, 7, 8 months that they actually were beginning on those trials. The only side effects, as we've said many times, is like with any other vaccine that you've ever taken, a flu vaccine, a shingles vaccine, all of the baby shots that our children and grandchildren have gotten through the years. Again, temporary things like a sore arm, it's hard to move it. You might have a headache, slight fever, might be a little achy now and then for a day or 2. Now, if any of this persists for a long period of time, then you should check back with your doctor. But I got a little bit of, my glands got a little swollen, like when you have a flu or a throat. So they got a little bit, I could feel them. But after a day or 2, and somebody just simply told me that the vaccine was actually making making those antibodies working to protect me from COVID. And so again, I'm not a scientist, but I'm a public health person. But this is our kind of simple graphics to explain to you what it is that you're putting into your body. So the Pfizer and the Moderna shots, you need 2 of them. They're 95% effective, which means out of every 100 people, 95 of them were protected from being contained, from getting COVID in the clinical trials. And so the little T that you see there on the left is the vaccine, the Moderna and biotech. Basically give you your body and the Johnson & Johnson body give your body instructions to make proteins that basically teach your body how to make those those antibodies to help fight the vaccines. And then if you go over here to the right side, the vaccine creates these antibodies. Vaccine just washes right out of your body like any other kind of medication that you take after a while, but the antibodies stay. If you were to come in contact with that virus, with the little spikes, that's the coronavirus, those antibodies attach to those spikes and don't let them attach to your cells. And so that's how it fights your ability to be infected. That's as technical as I'm going to get. It's kind of, I tell people, it's like when I take an aspirin or a Tylenol or ibuprofen, I really don't know how and why it works, but my fever goes away or my ache goes away. So I trust that the scientists that developed Tylenol knew what they were doing, and when they gave it so that I could take it, it helps me get better. And that's what I tell everyone in terms of these three vaccines. As I mentioned earlier, the Johnson & Johnson vaccine is different in that it only requires one shot. So we haven't gotten a lot of them yet in North Carolina, about 88,000, I think, last week, which is not a lot when you look at a state of 10 million. But the nice thing about it is that it's only one time. So for a lot of people in our community, taking a day off or taking time off of work is really hard to do. And so to be able to just do that one time is really a benefit to them. Again, it doesn't matter which of the three you get, all three of them are effective and protect you from becoming infected from COVID and the virus. The Pfizer and the other thing about the Johnson & Johnson is it doesn't require special storage. So it can be taken to rural areas very easily, remote areas. It could be stored for weeks, months. Whereas the Pfizer and the Moderna require 2 shots. The Pfizer today, and 3 weeks later, you have to go back for the second. The Moderna, you take it today, and 4 weeks later, you have to go back for the second. And again, you get Pfizer the first time, you get Pfizer the second time. You can't interchange them. And yes, you should try to meet that second date within a day or two of that appointment, if not that specific date. Again, both in terms of supplies and the logistics of trying to make sure we have enough second doses require that people really try to stay on that schedule. You're going to get a little card when you go. I should have brought mine with me. That after you get your first one, they're going to put down the date for your second appointment. You should go back to the same place that you got your first one, ideally. And again, that's why the Johnson & Johnson is such an advantage, because you only have to go one time. You don't have to make 2 trips. You don't have to take 2 half days off or 2 full days off of work. You don't have to, gas up your car twice. So again, all of those things make a difference. And then, of course, the state of North Carolina has created this, what we're calling the CVMS, COVID Vaccine Management System. Why did we create it? Because we felt we needed to have the control of what vaccines were given and to whom and when, and we wanted to be able to manage that. Really didn't have, at the time that the system was developed, we didn't have a federal mandate that provided any of this. And so we took it upon ourselves as a state to do it. The other advantage is that then that data resides in our state, and we know what we're doing and how we're doing it. We don't have to depend on the federal government to provide us that background. Okay, so here's some faces of people that you may recognize. I tell people that all of us over maybe 50 or 60 know some of these faces. I'm not so sure the young people do. But again, we've been trying to get pictures of all of our community members to be facing out, letting people know that it's a safe thing to do, that I've done it, you can do it too. And so I encourage you, if you do get vaccinated, to share your picture on your Facebook page and your Instagram, whatever your grandkids tell you to do. Put it out there so that everybody knows that, if they trust you and you're doing it, then maybe it's not such a bad thing for me to do it. Again, they don't know me, but they do know you. And so you're the voice in your community. You do need to be good. Again, of all those people, who do you recognize? Again, I mentioned that we created this CVMS, COVID Vaccine Management System. Basically, it's to track. We have to account for all the vaccines that are being sent to us, again, from the federal government. So we have to track it. We have to say we used it. We surely don't ever want to waste them, right? We want to be sure that we're using them. And again, making sure that that information is something that we can control at a state level. Personal information basically is just your name, date of birth, your zip code. We do not share this information with the federal government. All we share with the federal government is what they need to know, and that is the vaccine ID. You know, every medicine has a batch number, if you would, that says this was shipped to North Carolina and this was used. And then we say we used it on a male who was born in 1960. We don't give them the whole date of birth, and we don't give them the whole zip code. We only give them the first 3 digits of our zip code. So for me, it would be, this is a vaccine number. It was a female. She was born in 1953, and she lives in 276. And that's it. So there's really no way for anybody to attach that information to me. And that's the way we want it. In addition, of course, the state does ask our race and ethnicity so that we are able then to say that we've vaccinated X number of persons that are American Indian, or that are Black, or that are Latino. And that to us was important because we wanted to be sure that we were able to tell our communities who's been vaccinated, where are we doing well, and where we're not doing well, what do we need to do to change it? So again, I want to just reemphasize that yes, we're collecting information. You don't need to provide us with anything other than your name and your date of birth. Everything else is stuff that we're going to put on that little card for you. Okay, vaccines are available, as I said at the beginning, they're free for everyone. There's no need to have insurance. If you have insurance, great. Some locations may want to bill your insurance for the overhead or the administrative costs. It's a right to do that, but you don't have to provide insurance or insurance information when you go get, no matter where you go get the vaccine. Again, as I mentioned earlier, that stool with the 4 legs, the best way for us to get over this pandemic is to follow all those 4 pieces: masks, distance, washing hands, keeping away from possible contaminations, and the vaccine itself. Once the supplies are, and again, we've been seeing them increase every week. I mean, we're a lot better off today than we were a month ago. And hopefully a month from now, we're going to be a whole lot much better off than we are today. And again, there will be enough supply. We are totally confident at this point that there will be enough supplies for everybody that wants a shot to get a shot. So what did we do? At the beginning, this is December, and that seems 3 months ago, seems like a lifetime ago to those of us who've been doing this 24/7. We didn't know how many we were going to get until we got them. We got them on Wednesdays. So on Thursday, we knew how many we had to distribute across the state. The numbers were small, but we made a commitment that every county, no matter how small, was going to get some level. So we started first with the 11 big medical systems, university medical systems. Again, remember that these first 2 vaccines require really, 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 really cold storage, refrigeration that most places just didn't have. Even a lot of our local health departments didn't have them. So we had to purchase those. And, took a lot of time to get everything in place. From that 11, we went to 43. And now there's a wider range of distribution across the state and across locations. So local health departments, most hospitals, all of the federally qualified health centers, all of those. And then again, and this of course excludes our brothers and sisters on the west of the state who are in the Cherokee boundary area, because they get their supplies of vaccinations directly from the Indian Health Service. Okay, so that's above and beyond what we get in terms of the state of North Carolina. And today, as you all know, probably, I hope you know, that there's this FEMA event happening in Greensboro. We pick Greensboro because, again, a lot of different people can get up from all different parts of the state to Greensboro. It's where we usually have our conferences, right? State conferences, because it doesn't take as long for people to get up there as it does to get to Raleigh or to get to Asheville. So FEMA and the federal government are providing all the vaccines for that site. It's 3,000 a day, and Dr. Malik hopefully will speak to us about that when she gets here. That's above and beyond the supply that we would ordinarily get for North Carolina anyway. So that's just a great opportunity for us, again, to showcase our state's ability to put shots in arms. So what we did was we had to, prioritize. Everybody needs it. It's a pandemic. Everybody in the world needs it. How are we going to handle it in North Carolina? And so we got guidelines from the federal government, CDC. So again, first people to get them were our hospital and healthcare worker staff and long-term care facilities. Again, seniors who were living in nursing homes. They were the ones dying the most at that point in time. And healthcare workers, if they're not there to take care of us, who's going to take care of us, right? So it made perfect sense to start with healthcare systems. And that was not just the doctors and the nurses, but the people that clean, the people that feed, the people that, that bring people into the hospital from wherever they're coming into the emergency room. So all of the people that were involved in the system were first vaccinated, as well as long-term care. And again, long-term care separate in terms of the fact that they got their supplies from CVS and Walgreens. Again, a direct amount went directly to that group versus the amount that came for us to use across the state. And after that, we moved into what we thought were going to be the 75 and over population, and the federal government changed the rules in the middle of the week. And so we were scrambling to figure out how to get that changed. And so we changed it to 65 and over. So those, again, because that population was at higher risk of death and severe infection, we had to start with that population first. And now we've moved into the frontline essential workers. And on the 24th, we'll go into the adults with higher risk of exposures and additional frontline workers. And the frontline workers is really where a lot of our population is. It's those people that are, it's the teachers, it's the firefighters, it's the police officers, it's the grocery store clerk, it's the people that work in agriculture, that work in chicken plants, people that are literally, they can't do their work from home. This is my house. I can work from here. But if I were, if I couldn't do that and I had to be facing people every day, then I should be the person that gets that next round of vaccines. The next round of 4 is, again, anyone who hasn't already gotten a vaccine, who has 2 or more chronic diseases. And again, at any of these stages, we're talking about personal attestation. You're telling that site that you are one of these employees, you're one of these next in line people. And so we're not asking you to bring documentation that says you're a grocery store clerk. I mean, we don't have time for that. We really have time to get the shot in your arm, and the shot in your arm and the honesty that you bring to that testing place, saying, I am that person, I am in this group, I deserve to get it now. And then eventually, all the healthy people, the young people, younger people, also want to stress that these vaccines are not for anyone under 16. Okay, but I always get it wrong. One of them is 16 and one of them is 18. And I think it's Pfizer that's 16 and Moderna that's 18, but don't hold me to it. Just know that those are the ages are right. It just depends on which of the two. They are currently looking at, vaccines that might work with a younger population. But again, it doesn't mean that younger people cannot get infected, and it doesn't mean that younger people cannot die. Yes, they can, but the propensity or the probability is a whole lot less for them than it is for the groups that have already gone on. So this graph just shows you how we thought this through. The government decides how many are being produced. They tell us how many they can send us. The state says, okay, this is where I want you to send them to. The manufacturer sends it directly to that hospital, that federal qualified center. So it doesn't come to Raleigh and Raleigh disperses it. It comes directly from the factory to that provider. And then the provider has to have the ability to store it safely and to handle it safely. So even though you might be a clinic, if you don't have that refrigeration, then you're not going to be getting a supply. You might be getting some of the Johnson & Johnson this next round, but you haven't been getting the first two, the Pfizer and the Moderna. For example, my doctor's office couldn't give them because he doesn't have that kind of refrigeration. But maybe for the Johnson & Johnson, he might be able to start giving them to his patients. And again, just keeping yourself informed from reliable sources, your tribal governments, your local health departments, your local federally qualified centers, us at the state. We have a plethora of information. I put in the chat before I started our frequently asked questions. I asked that you all read those. This is 10 pages long. Okay, it's every time somebody asks us a question, we try to find the answer and we put it on there so that we can all be educated on what you can and what you can't do. No one person has all the answers, but if we all work together, we'll be able to provide really good information. And I really, really hope that all of your tribal government offices link back to your spot, your shot, so that all of that information, all of our graphics, that little, colorful chart that says the groups, there's detailed information about who's included in each group. All of that is available on our website. And I hope that you all link to it and help us. We have faith leaders, guides, toolkits where all of your pastors can have little blips on their bulletins or on their websites or whatever, so that the people are informed and that they know that the information they're getting is accurate and reliable. We've created a help center. That's the phone number. Please write it down. Again, on our website, you can go to, find my spot, your shot, whatever the thing is. If you type it in your searcher, it'll find it. It really will find it. You can even type in frequently asked questions, COVID-NC, and it'll take you to that link that I put in the chat. So yourspot.nc.gov. If you know nothing else, that's the quickest way to get to us. And here's a page. This is what it looks like. Lots of links that'll take you to lots of detail and information. I just want to tell you all of the different organizations nationally and even internationally that have supported the development of these vaccines. They're not testing something on us. They aren't just trying us out as guinea pigs. These are really reliable, as well as the science today knows, okay? And the science today knows a lot more than the science back in the day when I was a child. For example, I never got any child vaccinations because my mother didn't trust it, right? So I grew up without, I got the measles, I got the mumps, I got the whole thing. But today I know that these are viable and I trust them. And so I would hope that my children who are eligible at this stage, well, they're in stage 5, but at some point they'll be able to get their vaccinations as well. Here's some of the materials. Anything that we produce, stick your label on it, put your agency name on it, reproduce it, send it out, link to it, use it, help us get the word out. We've got some PSAs. If you've got some great PSAs that you want us to take a look at, send them to me. We'll see if we can put them on our website so that other people can use them. Again, just because you get the vaccine does not mean you have to take off your mask. Although I'm really, really excited that all my girlfriends have gotten their second shots. My sisters have gotten their second shots. And in a year, for the first time, I'll be able to see them and have them in my home and break bread with them. So I'm looking forward to that in 2 weeks. I'll actually be able to do that for the first time in a year. And again, as a grandmother, it's been 3 times in a year that I have seen my grandchildren in person with masks. And that I know is so hard for us to do, but we have got to do it. They're protecting me, I'm protecting them. So please, please, please help us keep this under control. When it's your time, please get your shot. Again, there's even we even have a little how to take your own selfie and send it to us page. So if you get your shot and you want to send it in to us, we'll put you on our website so that you can share it with your families and friends and colleagues. I talked very quickly. I don't even know how much time I have left, if any. Dr. Malik, I don't know if you're here.
I am indeed. Thank you for doing all of that. I am here. Hello, and
so
nice
please,
to meet you all.
Please share. Now I have to unshare my screen. Let's see if I can figure out how to do that. Stop share. There we go. Woo-hoo. All right. So are there any questions in the chat that I can answer at this point? Anybody?
Yes, Ms. Norma, I'm happy to share some of those questions. The very first one was the vaccine rushed to market too soon or any sooner than the polio and other vaccines that have historically been developed?
I would say no, because again, as I mentioned, these have been in development for 20 plus years. This particular one, they'd already identified the pluses and the minuses of a coronavirus vaccine. So they really just spent time in the clinical trials making sure that it was effective. I like to tell people that because they were already paid for, I mean, the federal government paid the companies to develop this. So there was no competition. There was no, oh, I have to write a grant to get money so that we could buy XYC chemical or whatever. So those kinds of things didn't have to happen because the companies were able to really just start working and get busy with it. So no shortcuts. The emergency authorization given by the FDA, if you want to call that a shortcut, but notwithstanding, they still had to be reviewed. They still had to have all 3 stages of the clinical trial. It was still reviewed by people that are medical scientists that are not part of that company or that cycle. So all of those steps were followed. All of those steps were followed. Do you want to add anything, Dr. Malik? I don't want to. But that is my understanding of the protocol and the process. It was followed like any other vaccine in modern history. I can't speak for the polio,
Yeah.
but in modern history.
Yeah, no, I'll just add, as Norma said, these vaccines were built on technology that is actually decades old. And so this is really, the way to think about this is scientists had a head start. So when you hear, words like Operation Warp Speed, I think give people the sense of, oh gosh, it must have gone way too fast.
Right.
And really all that happened is, as Norma mentioned, there are consistent phases of clinical trials to test something to know that it is both safe and effective. And because this was built on decades of technology, those same phases were followed, but they were able to go faster than they normally go. But I would in no way say that this was rushed to market too soon. So these are really robustly tested on tens of thousands of people. And now actually, I mean, look, I'll say the first vaccine went into an arm in mid-December. And so we've now got 3 months of data of seeing how these vaccines perform on top of the tens of thousands of volunteers in the trials. And the rate of severe allergic reactions or anything like that has been exceedingly low. And I'll just say the best part about the vaccines is when we look at the epidemiologic curves of what is happening to case rates and positive test rates from COVID, those numbers are way down, in particular for our 65 plus population, who were the first to get vaccinated. So the vaccines are working.
So to put it another way, we're saving lives since December this way. And that's what we hope to do from today on. I see a hand up for Greg Richardson, but I saw him stepping away. So I don't know if it's really Greg or just somebody else.
Yeah, and we'll come back right back to you, Mr. Greg. Quinn, do you want to share your question, or I'm happy to read it?
Yes, I can share it. Thank you for speaking with us today, Dr. Marty. It's been great. Are you familiar with the new NC SEAL? That's CEAL, Community Engagement Alliance, Community Response Teams?
Yes, it's one of those hats that I wear when I'm not wearing my DHHS hat. And I wanted them to be part of this presentation, but this was DHHS work. So tell me, Quinn.
So I'm actually volunteering with that group in addition to my duties with the Office of Public Engagement in Governor Cooper's office. This group just got started, I would say back in mid-December. And there's actually, I think it's 3 or 4 community response teams, one for the Hispanic Latinx community, for the African-American community, and for the Indian community. Right. And I got a 1-pager that I can share with you because it's led by, for those of you on the call, Ms. Kim Pivia, but also Dr. Jada Brooks, and she's a Columbia epidemiologist over at UNC. So I just want to, the whole purpose is, just as a small description, based on an emphasis of historical and unethical research, we naturally have come to distrust the scientific community. I think the vice president recently called it, that righteous skepticism. And in response, we formed a group of community and tribal leaders, medical professionals, and academic researchers to ensure Native American communities receive accurate and scientifically proven information on COVID-19 testing and vaccinations. So I'll include this one pager in the chat, but I just want to let everybody in the community know that the whole reason we formed this group is to get people to take the vaccine. Like I said, there's healthy skepticism. There's things that have been done to us as a community in the past, but this is not one of those things. And
Thank you for coming and being a voice.
Yes.
This is research done by the University of North Carolina and the Centers for Equity Research at UNC Chapel Hill. And it's, again, as Quinn said, 3 different groups: a Latino group, an American Indian group, African American group. Each of those, it's a small group, just 10 people, but those 10 people are taking a look at everything and making sure that our communities are being told the truth, and that there's no underlying falsehood to anything that's being gone. So thank you so much for sharing that. I'm so glad you were able to bring it.
And the group welcomes any suggestions or priorities that the tribal community has.
Thanks. Thanks so much, Quinn. Appreciate it. Yay.
Thank you so much. We'll turn it over to you, Mr. Gregg.
Yes. Just wanted to, Norma, thank you for that wonderful presentation. It looks like.
And I just want to say, I'm not doctor. I'm just Norma. Okay, just Norma. Okay.
Norma, thank you so much again for that wonderful information. It's very valuable, the work that you and Dr. Malik's doing. But we have been dealing with some concerns as it relates to COVID and the way that data has been collected in the state. Noticed that you had data that indicated that 126 American Indians had died. And I think I know the baseline for collecting the information, because when I got my vaccine, there was a place there for American Indian and Alaskan Natives. So we are very glad to see that happening. But we want to see if down the road, if there's a way that data can be collected by American Indian tribes in our state.
Okay.
The Eastern Band of Cherokee is in a unique situation in that they receive assistance from the Indian Health Service, so they can get that data.
Right.
But I'm not sure that Hawasaponi, Lumbee, Coharie, Waccamaw, Siouan, the other state tribes, don't think we can get that data. Although I do have to compliment Health and Human Services for developing a process through which we can collect that data by zip code. So at least with that data, we can make some assumptions from that in terms of the health of our population and the needs of our population. So that was the second point I wanted to make. And finally, the third one that we've been working with Health and Human Services on is the diversity piece that you mentioned. You mentioned the slides and the overheads and the pictures that was shown, whether we know anyone in the pictures, whether there's anybody there that looked like us. And I knew former Governor Hunt, but the other people I didn't know.
That's the only one I knew, too.
I didn't see a tribal leader or someone who was exhibiting American Indian culture. So we still need to work on that, because when the pandemic comes, American Indians and our culture and our communities should not be left out.
I 100% agree. And I will take both of those notes back. And again, I know I've been working with you for years to make sure that our birth and death records indicated American Indian, not just let people assume who we are not. So I will take that back to the the desk and reiterate that we would like to be able to get data by tribal, and I don't see why we can't. It's just adding another American Indian other, and then let us write in our tribal affiliations. It can be done. It might not be easy, but it can be done. So I will take those 2 points back. I agree that this slide deck does not represent not even all of us that are here today. One thing that I forgot to say is that anybody that wants to do this slide with your own, community or group. Of course, we have to do it virtually, but there's some of us who've been trained. If you would like to be trained, kind of like a training the trainer session that we do, so that you could give this in your communities, again, just I'll put my email in the chat. Just be sure and give me an email. I'll send you the time that the next training the trainer will happen, or I'll do a one-on-one with you as an individual group or tribal entity. And you could do this to your church members, to your neighborhood group, whomever you can round up around a computer to hear the story, or use Facebook or whatever other mediums you have. So I'll be sure and put my my email in the chat. Any other questions? One other thing that again, we've been developing at the Office of the Secretary, the Office of Minority Health and Health Disparities, and Greg and Jen have been part of our historically marginalized population work groups. I would like to see more people from the Indian community be part of those historically marginalized population work groups. Our goal at the state level is to be able to ask local health departments to create their own historically marginalized population work groups, so that we don't have to wait for a pandemic, but we already are talking to each other, so that whenever this happens again, and it unfortunately probably will happen again in our lifetimes, that we have a better understanding of who's where and who can help us get the messaging out. So if you're at all interested in working in our historically marginalized population work groups, again, within the state framework or at your local health department areas, please again let me know. I put my email in the chat. So thank you once again for giving me the opportunity to be present with you. I don't know if you recognize this, but this comes from one of the conferences that I attended in years past. And again, I miss the camaraderie, and I miss the music and the drumming and the food. So I can't wait for powwows to come back. Thank you.
Thank you so much, Norma. I too am ready for the conference next year, and hopefully you'll be able to join us if we are face to face. We will be. Dr. Leslie Locklear is going to give you some guidance for our workshop presentations.
So hello, everyone. We are so excited that even though this year things are very different in terms of workshops, that we had an amazing outpouring of people that were willing to share information virtually in terms of pre-recorded workshops. And we are so excited to share these with you all. Before we jump into workshops, I'm going to drop in the chat, if you do not mind, an evaluation before we close out today. If you do not mind taking a second and completing that evaluation just to give us some feedback. We will be back here again tomorrow at 2 o'clock. But here on the screen, you're going to see a list of the workshops that we have pre-recorded for you. The good news is that all of them are 20 minutes or under. And we really wanted to stick to that because we know what it's like to watch an extended video. These will be available to you for an extended amount of time. So please feel free to take a look at those. And I have a question in the chat that says what does SACE stand for? So that's the State Advisory Council on Indian Education. So that's our annual presentation, which is shared by Dr. Tiffany Locklear. So again, we want to welcome you all. I will drop the link to those below, and you're welcome to check them out. And before we go, there is one more thing that we want to share. We are excited that the Indigenous Pathways to Law is a program that works to mentor law students, those that are in law school and interested in law school. They're going to have a live discussion tonight from 8 to 9 p.m. Their login information is going to be located on the website. So we wanted to promote this for them because they are trying to get others engaged in the path to law. So if you are interested, that will also be on the website. But I'm going to jump right back to our workshop. So again, these will be available to you for an extended amount of time. You will also notice that on this same website at the bottom under our workshops, we have the amazing gospel singing. So Mr. Jesse Jacobs put together an outstanding video of the gospel singing, and I want to encourage you to bring it up and play it tonight and truly enjoy that. Even though it's nothing like being in person, we are excited to have that opportunity. So I will stop there and turn it over. We have one more question in the chat. No, there will be not be a presentation done today online. So everything in terms of those were pre-recorded, so they are available at that link. So again, you don't have to watch them all at one time. They will be available to you, and you can take a look at those that you're interested in. And I will turn it back over to Miss Gwen.
Thank you so much for joining us today. We're going to hop off here now. We will be back tomorrow at 2 p.m. Please enjoy the workshops, enjoy the gospel sing. If you have any additional questions, just shoot them to us in the chat and we'll try to answer them definitely tomorrow if we can. Thank you so much, and I look forward to seeing you tomorrow. Bye.